Tips to lower diastolic blood pressure. Diastolic blood pressure is the amount of pressure in your arteries when your heart rests between beats. A normal, healthy diastolic blood pressure should be between 70 and 80 mmHg. While diastolic blood pressure numbers of 90 and higher can increase your risk for heart attack, stroke, and other health problems, your diastolic blood pressure can be lowered by practicing a series of lifestyle changes, healthy diet, exercise, and in some cases, by using medical treatments. 1. Understand your blood pressure numbers. The top number of your blood pressure reading is your systolic blood pressure, pressure when your heart beats. The bottom number is your diastolic blood pressure, pressure in between beats. As such, practices aimed at lowering your systolic blood pressure will usually lower your diastolic blood pressure, as well. 2. Track your diastolic blood pressure regularly. This allows you to determine whether your diet and lifestyle habits are effective at lowering blood pressure. Start by checking your blood pressure twice a day for a week, once in the morning and once in the evening. Afterward, switch to 2 or 3 times a week. Once your blood pressure is under control, you can ease back to once or twice a month. Keep in mind that it is possible to have a diastolic blood pressure that is too low. 3. Consult your doctor. Even if you manage to track and lower your diastolic blood pressure at home, consult with your doctor or other healthcare provider about your heart health. Together, you and your doctor can work out a treatment plan that can improve and maintain your health with regards to blood pressure concerns. Your doctor will be able to guide you on ways to manage your overall heart health while lowering your diastolic blood pressure, and can also advise you on how to lower your diastolic blood pressure to a healthy level without reducing it too far. 4. Take prescription medications for blood pressure. The exact medication your doctor prescribes may vary, typically based on other health concerns you may have. Thiazide diuretics are the most commonly prescribed drug for relatively healthy people. If you have other heart problems or a family history of heart trouble, your doctor may prescribe a beta blocker or calcium channel blocker. If you have diabetes, heart problems, or kidney disease, your doctor may consider an ACE inhibitor or angiotensin II receptor blocker. Note that you generally won't need medication if you only have elevated diastolic blood pressure without also having elevated systolic blood pressure. 5. Follow your treatment plan as recommended by your healthcare provider. This helps prevent or delay complications associated with high blood pressure, and lowers your risk for related health problems. For example, if your doctor recommends exercising several times per week to lower blood pressure, make physical activity a priority so you can become healthier. On a similar note, if your doctor prescribes medication and that medication has negative side effects, ask your doctor about reducing the dose or switching, but do not stop taking your medication without consulting your doctor first. Follow up with your doctor every few months after going on blood pressure medication. 6. Check your cholesterol regularly. Regardless of your weight or size, it's important to check your cholesterol on a regular basis. High cholesterol can increase your blood pressure, so get screened each time you visit the doctor, especially if you're over 40. 7. Eat a diet comprised of healthy whole foods. Fruits, vegetables, whole grains, nuts, seeds, legumes, low-fat dairy products, and foods high in potassium naturally help improve heart health and lower diastolic blood pressure. Start consuming more whole foods, and cut back on foods that are processed and high in sugar and fat. Foods rich in potassium can help balance out the effect of sodium, so consider eating more potassium-rich fruits and vegetables, in particular including oranges, avocados, beans, greens, potatoes, and tomatoes. 8. Reduce your sodium intake. Excess sodium consumption causes water retention and forces your heart and arteries to work harder to pump blood throughout your body. Excess sodium can cause your body to retain water, which increases the amount of work your heart and blood vessels must do. Check food labels and recipes, and stick with foods that contain 140 mg or less of sodium per serving. 9. Consume less alcohol. Studies show that moderate alcohol consumption can improve heart health, but consuming more than 1 or 2 alcoholic beverages per day increases blood pressure and has adverse health effects. Lower your alcohol intake, and consult with your healthcare provider for recommendations on alcohol consumption. Note that 1 drink equals 12 ounces of beer, 5 ounces of wine or 1.5 ounces of 80 proof liquor. 10. Reduce caffeine intake. Caffeine is linked to higher diastolic blood pressure levels, which occurs when caffeine blocks the hormone responsible for keeping arteries widened. Reduce your current caffeine intake, and switch from drinking coffee, energy drinks, and sodas to natural white, green, and black teas when you need an energy boost. Technically, caffeine may or may not have a significant effect on your blood pressure. If you decide to reduce your caffeine, take several days to do so and lower your average consumption to about 200 mg daily, roughly to 12 ounces, 355 milliliters, cups of coffee. 11. Avoid consuming red meats. Regular consumption of red meats increases diastolic blood pressure and your risk for developing heart disease. This is due to the high fat content in meat, which raises cholesterol and increases your blood pressure. Stop eating red meats such as beef and steak and switch to eating healthier meats such as chicken, turkey, and fish. 12. Increase your intake of omega-3 fatty acids. Foods rich in omega-3 fatty acids can improve heart health and are effective at lowering blood pressure and reducing your risk for heart disease. While omega-3 fatty acids are a good choice, just about any monounsaturated or polyunsaturated fat can help your diastolic blood pressure. This includes many plant-based oils, including olive oil, canola oil, peanut oil, safflower oil, and sesame oil. Avoid foods containing saturated fats and trans fats, since these have a negative effect on your blood pressure. This includes fried and heavily processed foods. 13. Exercise for at least 30 minutes most days of the week. Find a physical activity you don't mind doing and add that activity to your daily routine. Start walking, running, cycling, dancing, or swimming, or work with your healthcare provider on developing an exercise routine that works best for you. Keep in mind that the type of exercise you do will impact how much you'll need. In general, try to perform 75 minutes of vigorous exercise or 150 minutes of moderate exercise each week, but check with your doctor first to determine what your heart can handle. 14. Lose excess weight. Focus on losing weight by exercising regularly and eating healthier foods, and consult with your healthcare provider about other effective weight loss treatments. If you're notably overweight, losing as few as 10 pounds, 4.5 kilograms, can dramatically improve your blood pressure numbers. Also note that carrying extra weight around your waistline can have an especially strong impact on your blood pressure. 15. Stop smoking cigarettes. Nicotine in cigarettes narrows your arteries, hardens artery walls, and increases your risk for blood clots, heart disease, and stroke. Stop smoking as soon as possible to lower your diastolic blood pressure. And consult with your healthcare provider about effective smoking cessation methods if you experience difficulty with quitting. 16. Reduce and manage stress. When under stress, your body releases chemicals and hormones that temporarily narrow your blood vessels and cause your heart to beat faster. Long-term stress increases your risk for major heart problems such as stroke, heart attack, and heart disease. Identify your stressors, and eliminate them from your life to lower diastolic blood pressure. Taking 20 minutes daily to enjoy a relaxing activity you enjoy, and practicing gratitude,